Welcome on board the Newstrack. First it was about vaccine diplomacy, then about vaccine nationalism, now it's about vaccine politics. Vote for vaccines. The big showdown is my top focus on the Newstrack tonight.
6 days before Bihar polls, BJP's big vaccine promise. Opposition cries vaccine for votes. Who will get vaccine first? Top focus on Newstrack.
The BJP sees nothing wrong. It says health is a big issue. It's good to put the vaccine project as the first promise in the poll manifesto. The opposition is seeing red. Is it ethical to promise free vaccines to all Biharis without announcing how the vaccine project will be rolled out nationally? We'll get you what's happening in the big vaccine rollout project. So when are you likely to get the vaccine? We'll talk about that. We'll talk about the politics around this promise in Bihar. We have a action-packed show lined up this evening. Let's get started. Here are the headlines. Days before the first phase of Bihar elections, the BJP released its manifesto. The first promise that the party has made is that of a free coronavirus vaccine to every citizen of the state. The opposition is up in arms. It's calling this vaccine for votes and saying, but what about other states? Will the vaccine rollout now be determined as per the poll schedule? The BJP says this is unfair, saying that state governments have to bear a certain amount, and for Bihar, the party has announced that vaccine will be provided free. Pandemic politics has taken center stage in battleground Bihar.
BJP has taken its shot for the Bihar elections. 6 days before the state goes to polls, the party released its manifesto of 11 sankalps, or promises for the people of the state. The first promise being free distribution of Covid-19 vaccine in the state, once it is approved by the Indian Council of Medical Research.
हम इधर प्रॉमिस कर रहे हैं बिहार में हर एक के लिए मुफ्त में वैक्सीन मिल जाएगा। वो हमारी पहला संकल्प पत्र के प्रॉमिस है। भरोसा के साथ बिहार की जनता को हम आश्वासन दिलाना चाहते हैं कि वैक्सीन फ्री में आप सबको मिलेगा।
The poll promise triggered a political storm, calling it vaccine for votes. The opposition slammed the BJP for its populist move, accusing it of fear-mongering. The Congress and RJD questioned how one state can be prioritized over others and who will pay for the vaccine in Bihar.
मोदी जी ने तो राष्ट्र संबोधन में कह दिया कि अभी शायद 1 साल तक तो वैक्सीन आने की उम्मीद ही नहीं। भाजपा बार बार झूठ बोलिए, जैसा नीतीश बाबू ने उन्हें बड़का झूठा पार्टी कहा था।
विश्व का कोई भी राष्ट्र, कल्याणकारी राष्ट्र या राज्य एक महामारी के खिलाफ जो वैक्सीन होता है उसको अपने चुनावी घोषणा पत्र में शामिल नहीं करता।
आंकड़ा नहीं बोला गया।
As the political storm raged on, BJP accused the opposition of twisting statements. The party's IT cell had clarified, saying, like all programs, Centre will provide vaccines to states at a nominal rate. It is for the state governments to decide if they want to give it free or otherwise. Health being a state subject, Bihar BJP has decided to give it free. MOS Health Ashwini Chaubey too declared that free corona vaccine will not just be for Bihar but for every state.
और केंद्र सरकार तो एक न्यूनतम मूल्य पे उपलब्ध कराती है। हमने ये वादा किया है कि हमारी सरकार बिहार में जो चीज आएगी तो हम सबको निशुल्क वैक्सीन उपलब्ध कराएंगे और बिहार को कोरोना मुक्त बनाएंगे।
After BJP's poll promise, now the state of Tamil Nadu too has announced free Covid vaccine as soon as it is available. Not just a free vaccine, the BJP is also promising 19 lakh jobs to the youth of Bihar and making Hindi a medium of instruction in engineering and medical courses. Will vaccine promise work or not? Voters of Bihar will decide. With Rohit Singh, Bureau Report, India Today.
Give me your vote, I'll give you a free vaccine. The opposition says, what happens if the BJP doesn't come to power? Will the vaccine still be free? Is the opposition seeing red for no reason? Because remember, the BJP hasn't said that the vaccine will be given only in Bihar or free in Bihar, but on a chargeable basis elsewhere. It's a promise. Is there anything ethically, morally wrong in the promise that's been made? To talk about vote for vaccines, let's kickstart a big Newstrack showdown tonight. I want to welcome first and foremost the national spokesperson of the Bharatiya Janata Party, Sanju Verma, squaring off against her. We've got Supriya Srinath, the Congress Party. Dr. S.Y. Qureshi is one of our most respected former chief election commissioners. Dr. Ajay Kumar is one of the best known doctors in the state of Bihar. He's been former president of the Indian Medical Association. Sanju Verma, first we spoke of vaccine diplomacy, then it became about vaccine nationalism, now about vaccine politics. Can you at the outset in this debate lay out why you think the BJP has done no wrong, that it's well within its rights to go out and say that to all Biharis, if you vote for us, we will give you a vaccine free? Let's start with Sanju Verma.
Rahul, first of all, I think you laid the ground rules of the debate very lucidly, because in your introduction, you categorically said that while yes, senior leaders like Bhupender Yadav or for that matter Ashwini Chaubey, they have on record stated that in Bihar, the vaccine by the state leadership will be provided free. Equally, what I think Congress people fail to understand is the fact that since health is a state subject, technically the center will provide the vaccine at nominal cost, and then it is for the respective state governments to give it for free or otherwise as they deem fit. Point number one. Point number two, this whole debate about the BJP trying to play the politics of opportunism. Excuse me, I want to remind the Congress a couple of years back, though they got a severe drubbing in the Telangana Assembly polls, please go back and look at your manifesto. You actually promised reservation in government jobs, promotions, and in educational institutions, reservations for a particular community, even within the minority sector, within the minority sect, pardon me, saying that you're doing this to protect the rights of minorities. So political opportunism is something that is at the core of the Congress DNA.
Supriya Srinath, what exactly is the opposition's problem?
Your Lokniti poll, excuse me Rahul,
yes.
Your Lokniti poll gives us a 7% lead. And mind you, last time with just a 7.7% lead, the Mahagathbandhan had stormed into power in 2015 in Bihar. So if we are getting a 7% lead as per your own poll, you know why the Congress is rattled. They can see the defeat staring at them in the eye.
So Supriya Srinath, what exactly is the opposition's problem? The BJP isn't saying that the vaccine will be given only to Biharis or it will be given only if the BJP gets elected. It's one of their first promises in this poll manifesto. And the BJP says every state government needs to decide whether to charge or whether to give it for free. We've said if we come to power, we'll give it for free. Why is the Congress so upset?
We're not upset. We're just pointing out the morally bankrupt and unethical practices of the BJP. I always knew they stoop low. They have done in the past, but I never thought they will stoop as low to use a global pandemic, to use what is perhaps the biggest health crisis the world has ever faced, and India is facing at a huge place. Please understand, 1,17,000 people dead because of this pandemic, 77 lakh people infected. You go to Bihar and
more than 42,000 people
Sanju Verma, one second. Faders down. Sanju Verma, allow me to lay out the rules of this debate. You had a full opportunity to speak. You wanted to speak extra. We held back and you did. Now that the Congress spokesperson is speaking, you must extend the same courtesy so we can have a sensible, meaningful debate. Try and win through the power of your argument, not through the interjections. Let Supriya complete. Supriya.
So I was just going to say that, the BJP is so rattled that they cannot even let you finish an argument, and because they forget, they go to those Banana Republic channels and they forget what happens in civilized debates. But that apart, it is absolutely morally bankrupt, Rahul, because in 1985, when a universal immunization program was launched, it was free for all. It has given vaccines for polio, which has ensured India is polio free. It has given BCG, which has ensured our mortality rate is low in corona. I am not going to talk politics there. It is the moral responsibility of the government to ensure free vaccination. Anything other than that would be held otherwise. You go to a state poll and you say free vaccination if we win. I'm sorry, you are going to lose. And then what?
So
we have not have vaccination. The rest of the country will not have vaccination. Why is she talking in between? Why does she have to speak in between?
You are in alliance in Maharashtra. There are more than 16 lakh infected cases. Point
I
number
cannot
one.
do a debate with somebody so uncivilized. I will not.
There are more than 42,000
I'm
deaths
sorry,
in
this
Maharashtra.
is not how a debate can be done.
She's
uncivilized.
No, one second. Both faders down. 1 second. Supriya Srinath and Sanju Verma. No, one second. Let's try and have a sensible conversation. Allow Supriya to complete as she has now. Sanju, I'm coming. Sanju, you can't be heard right now. Hear my question and then respond. Sanju, you can't be heard just now. Sanju, just hear my question. Supriya Srinath is calling you morally bankrupt, Sanju, saying that when vaccination is a public good, should it be held out as a poll promise? Is that ethically correct? Sanju Verma, please respond.
You know, Rahul, I want to ask you one thing. There is so much of hullabaloo and hue and cry about this vaccine. But where were the likes of this Congress spokesperson Rahul Gandhi, who takes a vacation before the start of every session of parliament, be it monsoon, budget session or winter session? Be that as it may, the Modi government gave 81 crore people free ration during last 6 months of the lockdown, point number one. More than 9 crore farmers got over 18,700 crores in their bank accounts, irrespective of whether they came from BJP ruled states or non-BJP ruled states. Have we said we will not give free vaccine or vaccine at a nominal cost to people from Kerala or West Bengal? No. Why is the Congress jumping the gun? You are trying to put 2 plus 2 together and trying to assume that if we are giving it for free to Biharis, we will perhaps be unfair to people in Kerala or West Bengal. It is because the Congress believes in the policy of damned if you do, damned if you don't. So let me tell Supriya Srinath, we have the lowest COVID mortality rate at 1.51% globally. So we are not morally bankrupt. We are
Supriya, let her finish. Supriya, let Sanju finish.
We have the highest recovery rate at 88.81%, despite the fact that our density of population per square kilometer is the highest in the world at 455.
Okay.
We have the lowest fatality rate at only 8 deaths per 100,000, whereas countries like the US have deaths of 50 or 60 per 100,000.
Okay.
And this is data in the public domain.
Okay. So Supriya Srinath, Sanju Verma's most compelling argument is you would have a point and the opposition would have a genuine problem if the BJP were to say Biharis get the vaccine free but Keralites have to pay for it. Then you can allege there's a left government in Kerala, there may be a BJP-led government in Bihar, and then that's a problem. But she's saying we haven't said anything of the sort. We haven't said that you will have to pay in Kerala and get it free in Bihar. So then why should the opposition have a problem? Supriya Srinath.
The opposition has a problem because the BJP, out of its desperation and being rattled by what it is seeing in Bihar, is doing things like this. If you do not think it's unethical for a government or for any party to put it in the election manifesto that you are going to get free vaccination, a party which is in power in the center, I have no arguments to make. But let me also remind my good friend here, who's yelling at the top of her voice and getting hysterical unnecessarily. I will just tell you one thing. We are number 2 as far as corona cases in the world are concerned.
On your face, despite the fact that your top leadership is politically bankrupt. I will yell at you if you mislead. I will yell at you if you misinform. The India Today audience needs to know the truth. And the truth is we have the lowest mortality rate in the world, the highest recovery rate in the world. We were the biggest country in terms of evacuating.
So, Sanju, you made those points.
Argument. This is not right, Rahul.
So do not.
I mean, why are you not
Sanju, let her complete. This is problematic. Sanju, one second.
I'm sorry, this is not right.
Okay, Sanju, 1 second. Supriya, but you also baited her, Supriya. You also baited her. Make the argument. Make the argument. 1 second, ladies, please. Make the argument. Try and win through the power of the statements that you are making. You don't need to fall low to try and win the argument. Supriya, complete what you're saying in a sensible fashion, please. Civil, sensible fashion.
I'm absolutely talking sensibly. Assembly. I did not even intervene while she was talking, and I wish you were making the same interjections you were making in mine. But anyways, all I will say to my good friend from the BJP is that we have twice the mortality rate of Pakistan, Bangladesh, and Afghanistan. We have 8 times the mortality rate of Sri Lanka. So I don't know which la-la land is she living in. She's the one who's misleading your audience through half-baked lies and half.
Okay, one second. Let me just go across to Dr. Qureshi. Maybe he can play peacemaker for a moment. Dr. Qureshi, you're hearing the Congress and the BJP. We're in the middle of a poll season, but you've been Chief Election Commissioner. If a political party in the middle of a global pandemic were to say that we will make the vaccine available free, is that okay? Health is indeed a state subject, and yes, a certain part of the money may have to be paid by the state, and therefore we're saying we will take this burden, our voters will not have to do so. Is that a fair promise to make, or is it morally bankrupt or unethical? What's your view, sir?
You know, Rahul, there are 2-3 dimensions to it. If it was a promise, a poll promise outside the manifesto, it would definitely have been problematic. It would have been rejected because it was designed to seduce voters, which is not allowed. Now, BJP has been smart that they have made it a part of the manifesto. Manifesto promises cannot be questioned. So technically, legally, they are within the ambit of law. However, I would like to remind you that the model code of conduct of election is not a law in itself. It's a basis, foundation is entirely ethical. It is a self-created code of conduct by political parties years ago. Therefore, ethically speaking, this amounts to a poll promise, in which case it becomes objectionable. Now, secondly, we used to get such proposal from the government. For instance, once a proposal came about increase in the MSP of agricultural produce. So immediately we said, look, in the middle of the election, you are going to make this promise. If it is good for the country, we'll surely allow it. But please tell us in the last 10 years, what is the date on which you have been announcing it? We realized that they were announcing it 2 months and 3 months later, and only because of the Punjab announcing it. So announcement can wait. It must wait. Now, what is the supreme urgency that within this week we can see that the vaccine is not coming now? This kind of announcement certainly becomes suspect, ethically suspect, that in 1 week there is no vaccine. Now, another question will be, suppose there is a vaccine after 2 months, having made this announcement for Bihar voters, will this announcement be extendable to the entire country then? You can't have 2 yardsticks because the election going straight.
Okay, Sanju Verma, the former Chief Election Commissioner, saying the decision is ethically suspect. It's not illegal, but it is immoral. The vaccine isn't coming out next week. The government hasn't at this time announced how much of the burden will be borne by the centre, how much will be borne by the states, and yet you've gone out and made this announcement. Respond to Mr. Qureshi, who calls this ethically suspect and immoral.
You know, I have tremendous respect for Mr. Qureshi. Be that as it may, I beg to differ with him very politely, because the fact of the matter is that ethics is something which is very subjective. Let's look at hard facts. And the hard facts say that constitutionally, we are absolutely, legally in a domain which cannot be questioned, point number 1. Point number 2, second point is, has this been the convention? Of course, this is the first global pandemic to strike the world and affect almost everybody in 102 years. But the fact of the matter is that giving SOPs is something that has been a part of the election manifesto of many parties. I don't know if Mr. Qureshi was there when the Telangana Assembly polls were held and the Congress was blatantly indulging in the politics of opportunism and appeasement. Point number 3, as you rightly said, Rahul, we have not said that we will not give the vaccine at a nominal cost to other states, BJP ruled or otherwise. All we are saying is we will provide it at a nominal cost, then let the BJP state leadership take the call to give it free or otherwise. And the BJP leadership in this case has unequivocally and overwhelmingly said it in the public domain that we will provide it for free. And the funny thing is, nobody's talking about the 19 lakh jobs that we promised. Nobody's talking about the fact that we provided in the last 5 years 28.33 lakh homes for free to the poor and the needy.
Dr. Ajay Kumar,
that we
the BJP is saying, okay, Dr. Ajay Kumar, the BJP is saying, one second, Dr. Ajay Kumar, the BJP is saying that nominally the states will have to pay, if the BJP comes to power, that part will be taken care of by the BJP state government in Bihar. But other states are saying, hey, we didn't even know that states had to pay a certain amount. We didn't know at all how and when this vaccine will be rolled out, how much of the burden will be borne by the center and how much will be borne by the state. The fact that states will have to bear a certain part of the burden was found out only through the BJP poll manifesto. Is it then correct to have made this promise? Dr. Ajay Kumar.
Well, very interesting. Thank you very much. I am coming at the end of the whole story. Even these two women have sorted out all the problems amongst them. Let me tell you first, by the time, our health minister is saying that the vaccine will come early next year. Well, my dear friend, by the time the vaccine comes early next year, Bihar will not need vaccine. The way the things are going, either due to clinical or subclinical infection of corona, they will be all immune. So the way that, all these hoo-ha about the elections going on, all these rallies are going on, all these things are going on, people are getting infected. There will be, the lady is saying like this, what does she know about medicine? I am an expert, let me talk,
Sir,
otherwise this is nothing political.
States are
so let me tell you,
Sanju Verma, please. Sanju Verma, with folded hands. No, 1 second. Sanju Verma's fader goes down.
Let me speak.
Sanju Verma, he's waited for 17 minutes
you
for his
lady,
opportunity to speak.
With respect, I tell you, let me speak.
Let him speak, please, Sanju. Go on.
So, she is unnecessarily interrupting me. I am talking only scientific things. So, what I am saying is there will be large number of people, probably by that time there will be herd immunity also and all, we will not need it. That is number one. Number two, the vaccine which is coming, what is, about Bihar, that we will get it first. So far we have been always at the back in the country in every respect. And this time Bihar is getting everything.
Rahul.
Why? Maharashtra has got the highest number of the COVID infected people. Other states have got. They should be having it. They should say that whole country will have it. What to talk about? This is
here's the point.
This is only election propaganda.
West Bengal have the highest number of cases, but you are maligning Bihar. I'm sorry, sir.
I am not a political person. Please.
Which other states
I am a Bihari.
Highest number of cases? Maharashtra, Andhra Pradesh, Tamil Nadu, and West Bengal have the highest number of COVID infected cases.
Sanju,
let me talk.
Sanju, he's a top doctor. Let him speak.
Do not mislead.
No, okay. Sanju Verma.
Talking and talking.
Let him speak. He's a top doctor, very respected across the state of Bihar. Let him speak. Let him speak. 1 second, Sanju. I'll come back to you. I promise.
Rahul,
She's just talking and talking. Modi ji will be very impressed by you. You have done a good job. But let me give you the facts of the matter. Number one.
Sir, don't get personal, sir. Sir, let's not get personal. Dr. Saab.
What do you mean personal comments? You are unnecessarily creating. Yeah, you don't call me then if such people are there. Let me give you certain facts.
Okay, let the doctor speak. For 1 minute, let the doctor speak.
The fact is that we are not sure whether the vaccine will come before June. That is, people are talking, Russians came out with one vaccine, somebody came out, but the fact of the matter is, before mid-year, vaccine is not expected. And before that, we should try to prevent the disease rather than think that vaccine will come and it will cause the magic cure.
I think the doctor is making an important point. One second. The doctor is making an important point. Now, I want to focus on this because the doctor is saying, in the manner in which the Bihar election is going, by the time the vaccine actually comes out, you may or may not need the vaccine because everybody will have herd immunity. And that's correct because we sent our reporters out across rallies, whether it's a JDU rally, an RJD rally, a BJP rally, or a Congress rally. There are no COVID protocols being followed. So we went with a list of protocols put out by the district administration, by the state government, by the Home Ministry, by the Election Commission, and we just went around rallies in Bihar seeing whether any of those protocols were being followed or not. The good doctor has an important point. You first need to keep the virus under control. The vaccine will come much later, many, many months away. But what's happening on the ground, all those detailed announcements which were made by the Chief Election Commissioner, by the Home Ministry, are they being followed at all or not? Our Bihar Bureau with this story.
The race to power in high gear, yelling, chanting, sharing the air, in tight quarters, maskless. An ideal concoction for the coronavirus to feed on and breed. Remember, the bug doesn't discriminate. It didn't even spare the White House, the President of the United States, or the First Lady. When a runaway outbreak occurred at a Rose Garden event late last month. It's well documented globally. Super spreader events unfold when people come together this way in close proximity with their guard down.
इतना बड़ा तंत्र इसमें लगता है, एक तो भीड़ जमा हो रही है, फिर इतने एम्प्लॉइज मोबिलाइज होंगे, फिर वो वापस घर जाएंगे अपने अपने, तो ये हम ईश्वर से प्रार्थना ही कर सकते हैं, प्रे कर सकते हैं कि लोग सुरक्षित रहें.
It's hard to pin a single political party or leader or a rally in Bihar. COVID protocols are brazenly violated almost in every major public meeting in a state battered by more than 2 lakh COVID cases till now and counting.
The ECI had come out with detailed guidelines on the 21st of August, which were given to political parties and candidates. The ECI has now ordered officials across the state of Bihar to take penal provision action against the candidates and organizers who are flouting these guidelines.
Almost all COVID protocols mandated by the Election Commission of India are visibly right out the window. The unfortunate outcome has begun to show. Bihar's Deputy Chief Minister Sushil Modi and the BJP star campaigner Shahnawaz Hussain have tested positive. But before he was diagnosed with COVID-19, that's how the Deputy Chief Minister downplayed the infection in his state.
इतनी बड़ी भीड़ देखकर लगता है कोरोना तो भाग गया. कहाँ है कोरोना? और ये बिहार है. मित्रों, हम लोगों ने जो बेहतर इंतजाम किया उसी का परिणाम है कि बिहार में केवल 950 लोगों की मृत्यु हुई है. दुखद है, लेकिन 950 लोग मरे हैं. और महाराष्ट्र जहां डॉक्टर ज्यादा है, अस्पताल बढ़िया है, वहां मालूम है कितने लोग मरे? 40,000 लोग मर चुके. 40,000.
In the meantime, the state's health minister Mangal Pandey and BJP MP Rajiv Pratap Rudy have also been home quarantined.
This irresponsible campaigning clearly shows that the political parties have not learnt any lessons from the ravaging coronavirus, and the results of that post-election could be disastrous. With Milan Sharma, Aishwarya Paliwal and camera person Nasir Ankit Tyagi in Jahanabad, India Today.
You know, this is a very, very serious problem. I have over here the list of guidelines put out by the Election Commission officially. Political parties are supposed to ensure that sanitizers are available, that thermal scanners are used, that people, netas and voters use face masks, gloves, face shields, PPE kits, ensure proper social distancing, not more than 200 people in one area, each person away from each other. Now when I see these pictures, Dr. Qureshi, you know, the EC guidelines are not being followed. No one's even trying to follow the EC guidelines. Look at this rally now on your screen. You know, Corona, what Corona? Is the EC so helpless that they'll just put out these guidelines and not be able to do anything about it, Dr. Qureshi?
Yeah, that's a very good question, and I've been asked this question in the last 3-4 days many times. And I said the Election Commission was very clear in its guideline, and they have based their guidelines on the experience of 34 countries of the world which have conducted elections already in the at the peak of COVID. And if they could do it, it is unimaginable for India's Election Commission, the greatest democracy, the largest democracy in the world, not to be able to hold the election. And you know, some people say, okay, look, Bihar is different from the rest of the world. Now that's a very laughable argument. It's a question of enforcement, and the Election Commission has now come down heavily, it seems. It's just a question of failure of implementation. Guidelines were perfect. Under the same guidelines, elections have been held in 34 countries, and so successfully that the turnouts have been the highest in the world, and no post-election spread of the pandemic. So to say that Bihar is different is totally unacceptable.
Dr. Ajay Kumar, if things stay the way they are, if netas and citizens keep flouting the COVID protocols and say, we are fine, we have great immunity, we are Biharis, you know, we're not worried about COVID, where do you fear we may end up once the election cycle is over? You know, what's the kind of eventuality you apprehend Bihar may have to deal with?
Well, right in the beginning, I said by the time the vaccine comes in June, there will be herd immunity in Bihar. You have seen my Deputy Chief Minister boasting about everything, and he is in the hospital. He is a good friend of mine. He is in the hospital. This is the way it is going to happen. Politicians are going to be infected now, and people are going to show the symptoms after the elections. And if they are not masking themselves, not distancing themselves, not washing hands, it is going to be a disaster. You have seen countries like Spain and all, COVID has come back with more intensity. And if it comes back with more intensity in this country, or at least in a state of Bihar, with a population of 12 crores, it is going to be a disaster, let me tell you. But people have not listened. Look at my Chief Minister without mask. Look at the Deputy Chief Minister without the mask. Look at how Rudy Sahab has got this. Mangal Pandey, our Health Minister, without mask. What is this happening? And they are holding the rallies after rally. Look at the photographs you are saying. They are self-explanatory. We need not say anything. And people like us who know the subject will keep quiet. And these politicians, free vaccine, free this, just to catch the vote, they will do all these mimicries and everything. I need to come in now.
Okay. And ultimately, Sanju Verma. Okay, Sanju Verma. Okay, I hear you, doctor. I hear you, doctor.
We doctors will suffer.
Okay.
Can I please come in?
No, one second. Allow me to ask my question and then Sanju will respond. Sanju.
Rahul?
No, one by one, please. Sanju. Now, the doctor is alleging that this is what netas should be focusing on by setting the right example. So many images of leaders without masks. It's almost as if there's a sense of misplaced machismo at play, where if you don't have a mask, you look big and bold and strong. If you have a mask, you somehow look scared. So you want to go out to the netas, I'll take it in the chest, I'll deal with COVID, I'm not scared. That's totally the wrong way of approaching a pandemic. The doctor fears we could be facing a massive health crisis before this election is over. Sanju Verma.
Okay, one area where I agree with the doctor is the fact that, as the Prime Minister said, जब तक दवाई नहीं तब तक ढिलाई नहीं और 2 गज की दूरी बना के रखिए. Where I disagree with him is that very conveniently he keeps on and on and on about how the Deputy Chief Minister has, been infected with the virus. Sir, let me tell you, the entire Uddhav Thackeray administration sits in the confines of 4 closed doors and walls. Despite that, many of their ministers have been infected with COVID, including NCP's top supremo, the top leader from there, who's a minister also in the Maharashtra cabinet, Mr. Jitendra Awad. This was a few months back. So, whom the COVID will strike, under what circumstances, that is something which is inexplicable at this stage. So you can only imagine. This is a figment of our imagination. But that said, we need to be cautious. But let me tell you, you said one more thing in your speech, Mr. Doctor Sir. 900 people have died. What is the population of Bihar? 10 crores. 900 divided by 10 crores into 100. Simple percentage. 0.0009% of the population is infected.
Don't talk that way. I have not said that.
0.009% of the
Correct
population
yourself.
is infected.
I have not said that.
Okay.
Correct
Will you talk
yourself.
about Maharashtra?
It is
where
Sushil
we have
Modi
a population
who
of
has
a
said.
little over 12 crore, but more than 42,000 people have
Sushil
died.
Modi.
You said you are not a politician.
It is Sushil.
But clearly, you seem to be the Congress acolyte here.
It is
you
Sushil Modi who has said, not
Congress
me.
spokesperson.
Don't try to tell
Why
me.
are you not discussing herd immunity in Maharashtra? Why are you not discussing herd immunity in West Bengal?
Second, I just want to show our viewers some very important. I just want to show our viewers some very important data. I've revved up the India Today Data Intelligence Unit Corona India dashboard, and this is crucial because it gives you a very quick sense of where Bihar stands. And as of now, Bihar is the 11th most impacted state in the country, so it's not amongst the top 10. But if you look at the graph for Bihar, at this moment there are 208,000 confirmed cases, 1,019 deaths, 196 recoveries. So Bihar is indeed way better off than any of the most impacted states, whether it's a Maharashtra, Tamil Nadu, Rajasthan, Delhi, Uttar Pradesh, Gujarat. But the fear really is that things could change if things continue in this fashion, and that's the point that Dr. Ajay Kumar is making. How you're apprehending a crisis, you understand the healthcare facilities in the state of Bihar. How bad could things get, Dr. Kumar, if these numbers start changing and what's happening in Kerala, Maharashtra, Karnataka starts happening in Bihar? Given Bihar's healthcare facilities, how dire do you think the situation could get? Dr. Kumar?
Well, let the lady talk about all medical things. She thinks that I am from Congress or whatever. I don't understand why she is that much conditioned about it. I fear, I am a Bihari, I fear that my Bihar after this election will be in real trouble. Because look at the way the people are behaving. The leaders are not masking themselves. How the leaders, the people will do it. And the effect will come after the election. When they are talking about vaccine lavenge or ye karenge. This is or not, I am worried. And that much I can tell you. That's
so now, but the problem here, Supriya Srinath, is it's not just the leaders of the BJP or the JDU who are violating protocols. I have over here Abdul Bari Siddiqui saying it's impossible to ask followers not to come. You've got another candidate, Birender Yadav, saying, why should I bother enforcing COVID guidelines? Let the administration do it. So this malaise cuts across the political spectrum. It's not just the government and its ally, the BJP, that's in power, that's creating this problem. Everyone's doing the same thing.
And it's irresponsible, whoever is doing it, whether they are from the BJP or the Congress. It's an irresponsible thing to do. It starts with the Home Minister, it goes on to Congress. It's just the wrong thing to do. It should not be done. But my only concern is that once the second surge happens, which it will in Bihar, I can tell you that, Bihar has no infrastructure to then support its people. Today, Sushil Modi can say only 900 people are dead. But guess what? We've seen visuals of what was happening in Bihar quarantine homes. We've seen visuals of how hospitals in Bihar were flooded and people had to be pulled on carts. We've seen all those kind of visuals. Bihar in the last 15 years has not been able to build a health parameter, a health infrastructure, which it should have ideally. And which is where we will see it all tumbling down. So we can talk about vaccine vultures, but the reality will be that it's going to hit us hard in our faces if we are not going to be careful. And that cuts across party lines. You can keep shouting at the top of your voice here, but that is certainly not going to help eventually.
Okay, Sanju Verma, Supriya Srinath, Dr.
Yes,
S.Y.
one
Qureshi.
needs to shout at the top of one's voice when you are misinforming. One needs to shout at the top of one's voice
so I'm
when
out
you
of
have
time.
another spokesperson misleading with rank.
Sanju Verma, Supriya Srinath, Dr. Qureshi, Ajay Kumar, thank you very much for joining us on the Newstrack. You've heard different points of view. A, if netas don't set the right example, if their workers don't make an effort to try and ensure that some basic norms are followed, forget thermal scanners, but just social distancing, masks, If you don't do that, you know, the former president of the Indian Medical Association is absolutely correct. Bihar will be dealing with a colossal health crisis just at the time this election gets over, and the vaccine is still some distance away, no matter what manifesto says what. So we need to take this seriously. There is no machismo in not wearing a mask or thinking that you'll take it in the chest, because once the disease starts spreading, there will be severe consequences. After the BJP in Bihar and the AIADMK in Tamil Nadu, now Madhya Pradesh Chief Minister Shivraj Singh Chauhan has announced that the COVID vaccine will be made available to every single citizen of Madhya Pradesh. Here is the MP CM who's campaigning for by-elections.
आज जिनकी आर्थिक स्थिति ऐसी होगी कि वो वैक्सीन का खर्चा नहीं उठा पाएंगे, उन गरीबों को फ्री में लगवाएंगे.
Okay, so he said those who can't afford the vaccine will get it for free. In Bihar, the promise is free vaccination for every single citizen. This is a story we'll hear more about over the next few days. This is where I wrap up the Newstrack tonight. I hope you enjoyed our power-packed broadcast. I look forward to seeing you at 8 p.m. tomorrow evening. Till then, from all of us here, goodbye. Good night.